be measured against others who are also striving to reduce casualties. Wherever we are and whatever we do in the world, we all must try much harder. In the UK, our road casualties have been falling steadily for many years. And we can see here that since the early to mid-1960s, sorry, go back, around here, there's been a steady fall in fatalities. And in those years, we had around 8,000 fatalities here, and it has fallen down to just 1,713 in 2013. That's the lowest record since records began in 1926. And yes, this is a very good success story. So what is the problem? Well, the UK has actually a poor record for pedestrians. The data shows that the UK has the worst record in Europe for child pedestrian deaths. The UK also has the worst record in Europe for adult pedestrian deaths. So there's very much to do in the UK to improve on these figures. And I'll talk more about this later. So our headlines are that in 2014, the number of people killed on our roads increased by 4%. We saw the first rise in serious injuries since 1994, and the rise in slight casualties is significant. But more worrying is that pedestrian fatalities were up by 12%. It really is too early at this stage to identify the key contributory factors. However, if we look at some of the data, including data from hospitals and eyewitness accounts, we can see that the key contributory factor is likely to be distraction. And that may involve a number of activities or causes. Also, we found in the UK, due to the recession, that drivers were driving much less when petrol prices were high. And in 2014, when petrol prices began to fall, many more drivers took to the road. And that may account for the rise in casualties, or part of the reason why. So the factors in pedestrian casualties, we're seeing a significant rise in the numbers of drivers who use mobile phones. And we're seeing a significant rise in the numbers of pedestrians who use phones, tablets and music devices with headphones while crossing the road. More children in schools now own a mobile phone, and as we all know, children are easily distracted and have poor impulse control. The standard record completed by the police following a road accident does not as yet record accidents where a pedestrian has been distracted by such a device. These types of collision are usually recorded as failed to look. Now that is not on the slide, but you may want to write that in your book, failed to look, or failed to see. However, based on observations of pedestrian activity, it is clear there's a growing and significant issue with distraction and mobile phones. There is also much evidence that alcohol plays a significant role in pedestrian accidents, mainly involving, but not exclusively, young people during late evenings and weekends. Alcohol causes obvious difficulties for pedestrians. Peer pressure, or the pressure that people feel from their friends and those close to them, plays a significant role in pedestrian behaviour, especially amongst young people in groups. And those who would normally cross a road safely and sensibly often feel compelled to display risky behaviour so they feel part of the team. So there's much work to do to ensure that the right data is collected by the police after the event of an accident. And there's evidence that more people need to have mobile phones and other devices, and we are becoming reliant upon them. It's becoming part of our culture, not only in the UK, but around the world. And this is one area, a very difficult behaviour that we have to change. In the UK, we also need to tackle the growing issue of alcohol-related casualties, but also through behavioural change techniques, we need to help children to develop coping strategies to be able to deal with the power of pressure from friends. This graph is very interesting in that it shows little change over the last 15 years in the UK in the number of miles walked. The line in the middle is the number of miles walked by the public, and that is around 11.7 billion miles. But you can see the graph also shows that pedestrian casualties are coming down until 2013, 2014, when they started to go up again. So the public is not walking more or less, but they appear to be walking safer. So what went wrong in 2014? We still need to work that one out. Our government, through public health departments in local councils and other agencies, is striving to encourage the public to walk and cycle much more, not only because of the health benefits and the cost benefit to the National Health Service, but because the UK has a very poor record also for children who are overweight. The government clearly has a public health issue, and this is why there is so much encouragement to become more active and cycle more. And this inevitably creates a dilemma for road safety professionals, in that by encouraging the public to walk and cycle more, we may see an increased exposure to risk and the potential for a rise in pedestrian and cycle casualties. Yes, we must encourage healthier lifestyles, but the difficulty for road safety managers, who are all vying for a slice of a very small financial cake, is that the government has a much bigger issue with deaths through inactivity than it does through road deaths. It is estimated that around 30,000 people die each year from transport-related illnesses, such as respiratory and heart disease, and only around 1,800 each year from traffic collisions. So in times of austerity, it is clearly a problem for the government when funding is required by a number of agencies. This leads me on to organisational delivery. The statutory duty for providing road safety education, training and communications lies with local government, those authorities that have the responsibility for highways. However, many other organisations have a strong desire to be involved in casualty reduction, such as the fire and rescue services and the police. The health bodies, such as public health, which was a central government department, is now part of local government, and it's also becoming more involved in facilitating road safety delivery. And due to the huge interest in improving activity and health, active travel teams are now emerging in almost all local highway authorities. So there is a growing impetus towards the need to work together, and we are seeing more and more joint activities and sharing of resources, which can only be a good thing as long as it is managed effectively and efficiently. The partnership approach is proving to be much more effective. Let's now look at some common facilities in the UK. The School Crossing Patrol was introduced in 1954 and has served to keep millions of children safe on the journey to and from school. In 2000, the government introduced legislation to enable patrols to stop traffic for adults as well as children. I would like to mention the uniform, if I may. The uniform varies only slightly across the whole of the UK, with most patrollers wearing the same uniform. This is very important so that motorists anywhere in the UK can quickly identify a patrol at a distance and not be confused with other forms of road worker. It is clear that this person is helping children to cross the road safely. The zebra is the earliest form of formal crossing, which dates back to 1948 and is now common in almost every country. I'm sure you're very familiar with this facility, so I won't talk much about this, only to say that many of these zebra crossings are now being replaced by light-controlled crossings. And the first one I'd like to mention is the Pelican. The Pelican means pedestrian light controlled, and it's a simple system that gives a degree of certainty that traffic will stop. However, what we find in the UK is that most drivers do stop at pedestrian facilities, but occasionally they don't. It isn't a habit that they have. However, there is an inherent risk element. For example, pedestrians who arrive late at the crossing and dash across before the lights have changed, and pedestrians that cross outside of the designated crossing area, and those who cannot cross in time, for example, elderly people. There have been a few government campaigns aimed at raising awareness many years ago of how to use these types of crossings, but there is much more education in schools using working models to train children on how to use these facilities. The Puffin crossing is a a big improvement on the Pelican. It means pedestrian, user-friendly, intelligent. It is intelligent in that it knows when a pedestrian is standing waiting to cross by using detectors in the footpath, just there. And it also uses detectors on the light poles, on the heads, so it can tell when a pedestrian is waiting at the curbside, and it knows how long a pedestrian is in the road. And therefore, the lights will not change until the road is clear. And this is very useful for people who are infirm or elderly and who take much more time to cross the road. The two can crossing is a very simple meaning. It means that two can cross. It's meant for pedestrians and cyclists, and it incorporates a cycle lane. The crossing is usually wider to incorporate cyclists as well as pedestrians, so there are no collisions. Just to take that a step further, countdown. A study of all of the common light control facilities revealed that 2/3 of pedestrians are confused about the amount of time they have to cross the road safely at junctions with traffic lights. Following some consideration of this, pedestrian countdown timers were developed and installed in London in 2010. The timer shows the amount of time left to cross the road before the red man appears. Now, this allows pedestrians to decide if they have enough time to cross the road. The duration of the countdown marker, which is shown there, it varies depending on the signal timings at the junction. This began as a trial and has since been rolled out across London at 200 sites. This morning I was looking on the internet and read a news item that London agreed yesterday to roll this facility out to 800 sites across London before June 2016. Because pedestrian countdown shows exactly how much time is left to cross, pedestrians are less likely to panic or to stop in the middle of the road. And an off-street public trial of the technology showed that more than 85% of pedestrians felt safer and more confident when crossing the road when a countdown display was present. So this seems to be a very good idea. 20-mile-per-hour zones can be found in many areas of the UK, and the number of zones is increasing quite rapidly. However, there is much debate as to the effectiveness of 20-mile-per-hour zones in terms of pedestrian casualties. In the early years, the zones also incorporated physical traffic calming measure that created issues for drivers and were very unpopular. However, we're now seeing more zones being introduced without physical restriction and indeed without the support of enforcement. Zones appear to work well outside of schools, where the speed limit is only reduced during the school opening and closing times, and it allows traffic to flow freely when there are no children around. So there's some of the very short look at some of the facilities we have. And infrastructure is very, very important, and the facilities provided are varied depending on the context and the environment that they are placed in. But they're not worth a great deal if users, our pedestrians, are not informed of how to use them and of the risks that they face if they're not used correctly. This is vital. For example, we would not give the car keys to someone who does not know how to drive. So we should not assume that everybody would know and understand and have the confidence to use one of these pedestrian facilities. The public will learn much through social learning, but targeted awareness in the form of publicity campaigns and training is vital, especially for younger people and elderly people. And this brings me on to education and training. It is very difficult to get road safety education into British schools because of the very tight schedule in the curriculum. But there are two areas that have been shown to be very successful in schools, and that is pedestrian training and cyclist training. And I'll concentrate on the cyclist training element for today. The first fully evaluated scheme was set up in the early 1990s by Professor James Thompson of Strathclyde University, and following successful piloting and evaluation, it has been rolled out across the UK. The training takes place outside in the real world over a number of weeks, and it's designed to build knowledge and skills in a logical order. I can't go into the detail of the scheme here because it is quite lengthy, but the evidence shows that the model has a number of significant benefits to children who've been trained. For example, those who've been trained are much more aware of risk and danger than those that have not been changed, and therefore are likely to show better behaviours when crossing the road. There are also benefits to the schools who are involved in the wider communities in terms of the opportunities to involve teaching staff and parents as trainers. The scheme has been fully evaluated, and you can find the full evaluation using that link there. So many thousands of children use this scheme every year and enjoy it and get much from it. I believe that every year we train around 50,000 children using this scheme. So what about the skills of those that teach or train in road safety? Who looks after them? Well, Road Safety GB Academy is making great strides and to make sure that all those that deliver road safety are trained to a high standard, and the government has endorsed this and given us the mandate to set standards for road safety professionals. This is really, really important, and we introduced the Academy 3 or 4 years ago, and that from the Academy we developed a number of courses aimed at various types of profession. In every course we concentrate on behavioural change. So why are we focused on behavioural change? Well, we have some of the very best roads in the world. British motorways are extremely safe, designed to a high standard. Cars around the world, not just in the UK, have the latest technology, ABS systems, airbags, etc. And we have fantastic facilities, as we've seen, electronic systems to help keep pedestrians safe. So why do we still have so many people involved in road accidents? The one element that we have not really dealt with in the equation is the human attitude, the effect of emotion and context, peer pressure, our perceived behavioural control, and how all of this affects our intended behaviours. I believe we're now entering into a world where we must focus on intelligent teaching, training and messaging. We cannot remove every risk by design or keep doing things simply because they look good. We must use science, psychology and sound educational principles to better inform our road safety interventions. Many agencies use very graphic imagery of human trauma in an attempt to shock road users into changing their behaviour. We now know that this can be very dangerous and can create unintended consequences for some groups of road users. Not all, but some particular groups. By using behavioural change models and other techniques, we are now convincing those who in the past only knew one way to teach road safety, and that was negative messages and trauma, that there are many more positive ways to get the message and the training across. And we are astounded by the huge shift in their understanding. I briefly mentioned messaging. I'd like to just talk a little bit about this in more detail. Getting messages right in terms of influencing behaviour and road safety is very, very important. And it's much more important than getting a sales message right. For example, if we get a road safety message wrong, the unintended consequences could be a road death. If we get a sales message wrong, the worst thing that can happen is that we don't turn a profit. So what are some of the problems with road safety messages? Well, messages are often designed by the sender, and we don't take account of what the receiver really needs to hear. We design messages around what we want to say and not what the end user needs to hear. Our messages need to fit with the receiver's reality, not our reality. And this is important and key to all messages. And messages come from different forms. Expert messages that appear to come from someone in authority are often not believed because receivers are biased. Many receivers think that the expert would say that because the expert gets paid to say that. Also, it is difficult, for example, for the police to put a speed message across to drivers when they themselves are seen to speed, even if it is in an emergency. And peer-to-peer messages, friends to friends, are more credible and they fit better with a person's reality. And words and images that help a person to self-generate messages can be so much more effective. Statistics mean very little and are uninteresting to the average member of the public. Using lots of numbers to illustrate the danger to pedestrians will almost always fall on deaf ears. And images and messages about death and trauma will be ignored by most because it is not their reality. The "it won't happen to me" syndrome. The optimistic bias model that we use in our courses shows that traumatic images can actually increase risk to some road users. So road safety messaging needs to be very positive and upbeat. We need to expand good beliefs and minimize poor beliefs. But we must also alert our road users to the risks and provide them with the strategies to cope. I have some examples of poor messaging. Using the words dying and dead. A dead person do not fit with the young person's reality, as I have said, and they will ignore the messages. It won't happen to me because I am very optimistic, I am invincible, I am a safe road user. It's not their reality. Use of statistics, again, would a person really read this and take that as a very strong message? Probably not. And how would a young person react to a picture of a tire mark across a face? It's not realistic, that doesn't happen, not in their world. But our messages are getting better. Drive sober. Why wouldn't you? In this example, the sender is asking the receiver, the driver, to make some considerations, which generates a thought process, which he or she may or may not take into account. But it makes the person think about it. This is positive. Get around your city safely. This one, it does not use statistics. It is non-threatening. It merely suggests that we should all take more care. Again, a little thought generator. And stop when the sign is displayed is a very strong and clear message. It also says that it is the law. So it is clear and it is informative. It helps people to consider and make the right decisions. These are just a few examples of better messages, but clearly we still need to do more and we need to improve on our positive messaging everywhere. So, good messages should show positive images, have positive statements. They should promote positive lifestyle, positive behavior, and positive attitude. In architectural terminology, they should be people-friendly. We must get away from telling our drivers and pedestrians that there is a good chance that they will die. This is very negative, and in most cases, as I have already said, the receivers will turn off from the messages as they believe it will not happen to them. So I hope in a very short presentation that I've given you some insight into how we provide for pedestrians in terms of infrastructure, how our delivery process is needing to change due to the economic and political climate, and how we're developing our education and training, looking much more at behavioural change, and why we need to examine and rethink how our messages can be developed to avoid having a negative impact on the very people we are trying to help. Finally, partnership working is very, very important, both internally, inside the organisation, outside of the organisation, nationally and internationally. We must use all of the combined resources that we have in a positive and efficient manner. Road Safety GB is very keen to work with others globally to share knowledge, but also to learn from others. We're very happy to share knowledge and skills with you, and I would hope that you could share your skills and knowledge with us. We're here to provide help wherever we can. Thank you very much.
네, 이제 발제자가 이제 두 분 남았습니다. 다음 발표해 주실 분은 현대해상교통 기후환경연구소의 이수일 연구위원님께서 보행자 통행 실태와 사고 특성이라는 주제로 발표를 해주시겠습니다. 이수일 박사님은 어린이, 노인, 보행자, 자전거 안전에 대한 연구를 많이 수행하고 계십니다. 큰 박수로 환영해 주시기 바랍니다.
네, 안녕하십니까. 현대해상 교통기후환경연구소 이수일입니다.